best way for parents to identify simple newborn rashes in their children is to understand what they look like. Four of the more common newborn rashes that we see are Milia, Nevus simplex, Erythema toxicum, and seborrheic dermatitis. Milia is seen in approximately 50% of newborns and looks like tiny, pearly, white or yellow bumps on the bridge of the nose, the cheeks, and the chin. It's caused by plugged glands in the skin and typically resolves by the time the baby is a month of age. Nevus simplex, or salmon patches, are seen in 30 to 40% of newborns. It typically presents as flat, dull, reddish-pink patches on the forehead, the eyelids, and the nape of the neck. It often is more noticeable in infants when they are warm or fussy. It typically fades in 95% of infants by their first birthday. Erythema toxicum is a fancy name for a blotchy, innocent rash that typically appears in the first few days of life. There could be anywhere from a few spots to hundreds of spots. The spots are red splotches with white bumps in the middle. Individual spots can last anywhere from a few hours to a few days. This rash comes and goes, but typically disappears by about 2 weeks of age. Seborrheic dermatitis in infants typically presents as cradle cap. Cradle cap is a thick, oily yellow scale on the top of the head. Usually, simple scrubbing with a mild baby shampoo will be sufficient to raise the scale. In more persistent cases, applying a thin film of olive oil 30 to 60 minutes before shampooing will help to soften the scale and make removal easier. In most cases, cradle cap will resolve by 4 months of age. Rashes are certainly very common and oftentimes concerning to parents. If your child seems bothered by the rash seems to be getting worse, or you're worried, give your doctor a call and set up an appointment to be seen.